Hello everyone. I haven't really made a video in a long time, and I used to make them all the time. And I don't know if anybody watched them, but I made a lot of them. I used to make videos to document my pre-transition. Excuse me, I've had like a sinus thing. The past couple days I've been totally freaking miserable. A lot has happened since the last video I made, actually uploaded. I ended up, it's about, I want to say, 3 weeks after I made my last video upload. I don't even know if it was that long. That I ended up being completely paralyzed. And before y'all go, wait and listen, I ended up being life-flighted after 8 hours in an emergency room. Being life-flighted to Kansas City University Hospital, or University of Kansas Hospital, however you want to say it. The Jayhawk Hospital. Where they, after many weeks of testing and turning me into a giant human guinea pig, pumped me full of steroids and IVIGs, which are like human plasma cells that help you regrow your muscles. Told me that I had a rare disease called polymyositis. And of course I had never heard of it, so the immediate thing I did was had my mom, who was with me through the whole thing, set me up to where I could use my computer, because my fingers would still work, and my toes worked, and my feet worked. It was just everything else in between that wasn't functioning. I googled it once she got my hands up on the keyboard. And I found out that it's not necessarily a life-threatening condition. I have 2 years to go before I am totally out of the woods of having a post-diagnosis condition of like heart disease or a something called ILD, interstitial lung disease. I take 5 milligrams of prednisone in the morning, which, if you don't know what that is, you can Google it. It's that stuff they give people with asthma. I should know, I'm an asthma sufferer many years. I didn't know, but that put me more at risk for developing another. It's autoimmune. This is autoimmune. It's also considered a muscular dystrophy. Went that route, wasn't really impressed. But they do a lot of good, I know they do. Just not where I'm at. Trying to think, it's like 2 in the morning and I can't sleep, so I thought I'd do this. Basically what it is your body turns on you and starts eating your muscles until they swell up and burst. Almost every muscle in my body, including my bladder, muscles and stuff, quit working. Everything had to grow back. I had weeks of rehab therapy. Well, actually months if you count the outpatient. And I went through a lot. And while I was in the hospital, I was in my, I want to say 7th or 8th. I was in like my 8th week of physical therapy. I was shipped back to my hometown for that. And I was getting helped into bed, and it was by my mom, and I raised my arm up. She'd gone to get me a container of milk or something, and I had 2 strokes. Well, the reason that I had 2 strokes was because, see that dark line right there? That's a scar from a muscle biopsy that they said they had to do to diagnose the condition. They knew what I had the second day I was up there. They just wanted to experiment on somebody. Because it's such a rare thing, they have to find out, you know, all they can. But they didn't have to put me through hell to do it. I've been beaten. Been made fun of. Been told I was obese. Probably never took care of my body a day in my life, which was a lie. Lost 68 pounds of fluid out of my body, which made me super thin for a while, especially with no muscle. I literally look like Gumby. You know, like you can just take and pose him. That's pretty much what people had to do with me to get my muscles to grow back. They had to take me and put me in different poses. The first time I sat up in a chair, oh my god. I was supposed to sit there for like 30 minutes. I couldn't make it for 20. It was terrible. The pain in my butt. The muscle, it was just bare bone. I was sitting on skin and bare bones. And it was horrible. It was painful. And that was where I had the most pain, was that and the muscles in my back all regrowing. And, you know, it hit me. It hit me a lot harder than it hits some people. Because, you know, being trans, we work so hard to get every little inch of muscle we can, and to lose all of that, it's kind of like, you can look at it one of 2 ways. It's kind of like, hey, being reborn, and you have to build more muscle than you had before, or it's like losing everything you worked for. And unfortunately, I didn't look at it in the positive direction at the time. But anyway, the doctor that did the muscle biopsy, he never came back. He never came back to look at the wound. He sent a first-year student up to do it. And he said it looked normal. We complained to all the nurses. Everybody did. My mom, me, my grandma wasn't happy. Because it swelled great big, and hematoma, it turned black. It was awful. They ended up putting this stuff on it when I was in rehab called this kinesio tape. I don't know if anybody's had used it or not. They use it to take and lift up the swelling so that it releases into the body instead of, you know, just collecting there and clotting up. Well, they were they were a little too late. It had already done that, apparently, badly. And all the signs were there. They just weren't in the spot that they were looking for, because I had been bedridden for so long. They were looking for, like, in my legs and in my chest. And there was nothing. No evidence. But when they scanned this baby, a few months later, there was still a clot inside of it. And I prayed. I was like, not another one. Please, not another one. It was scary. It was more scary after I came out of it, because while I was in it, I had the mind of a 5-year-old. I mean, I knew there was something scary going on, but I didn't literally think it was me. It was anything with me. I closed my eyes for like, I don't know, it's probably less than a minute now that I think about it, but I closed my eyes and I saw my body just kind of floating up to this beautiful, gorgeous, I mean, there's no palette of blue on the scale of hues that is as blue as is as blue as what I saw. And you know, I was being carried by these two great big muscular dudes, just floating up. And then 5 seconds later, I got pulled out of it, and I said yes to the therapy, and maybe 10 minutes after that, I was normal again. And I cried, and I cried, and I cried, and I cried, because I couldn't understand it still. My brain was not working. I got really close to knowing several people in the hospital at the time, and one of them was the the inhalation therapist who came by every evening to give me my breathing treatment. And I just looked at her and said, "Hi, how you doing? I had a stroke." She's like, what? And she followed me clear into there. And then I didn't know at the time that she held my hand all the way through it. At the time she was there because I may have had to have been intubated. But now I'm better than I was. I take a cancer drug. It kills my immune system to the point of where my cells don't attack each other. So I guess that's good. And I take blood pressure medicine, and I take neuropathy medicine, because being on steroids for so long gave me neuropathy and diabetes. Well, the diabetes first, I'm sure, and then the neuropathy. They checked my insulin, or my glucose numbers, and my doctor did, my general doctor, and she actually said the F word. They were like running in excess of 400 to 500 over the past 3 months, and now I'm down to where in the morning it's in the double digits, in the afternoon it's up a little bit, but that's after I've had all the medicines, and at night it's down back in the double digits usually, unless I've had, too much. But that's what's been going on with me for the past few years. I've just been trying to, I can't do a lot of the things I did before. I've had to learn how to redo stairs all over again. I used to just run down them, now I have to take my time, which I'm not a very patient person, so it doesn't work very well. So every time I go downstairs, I just remind myself, do I want to go fast and end up on my face, or do I want to go slow and make it? And usually I just go slow and make it. I've only fallen a couple of times, and that was coming up the stairs. Yes, I'm not very gifted with stairs, never have been, so nobody questioned that. And I don't squat down easily. In fact, I usually get stuck if I try now. I have the knees of a 40-year-old instead of a 28-year-old. And right now I feel like I have the sinuses of an 80-year-old. This is all just sinus, so, nobody has to worry. It's already better than it was a couple days ago. My throat was all sore, now I'm just hoarse from coughing. So it's running kind of long, so I'll get off. But yeah, that's my comeback, I guess. Bye.